everyone. Today, my group will be presenting on the topic obesity and lifestyle in Malaysia, time for change. Hello, my name is Nur Shaira binti Muhammad Zan and my partner.
Hi, my name is Roy Jasmine binti Muhammad Tagih.
Okay. Next, we will present about the introduction. Obesity has become a major public health crisis in Malaysia. According to NHMS 2023, more than 54% of Malaysia adults are overweight or obese, and childhood obesity is also rising. Obesity happens when a person has excess body fat due to poor diet, lack of exercise, and unhealthy lifestyle habits such as long screen time and low physical activity. This issue is serious because it increases the risk of diabetes, stroke, heart disease, and other long-term health problems. Because the number keeps increasing, we should need urgent action to promote healthier eating, more physical activity, and better awareness about obesity from a young age. Next, we will move on to the credibility. To ensure the information in our presentation is accurate and reliable, we use two credible research articles. The first article is from National Center for Biotechnology Information (NCBI), titled Prevalence of Childhood Overweight and Obesity in Malaysia: A Systematic Review and Meta-Analysis 2024. This article provides statistical data on childhood obesity trends from the 1990s to the early 2020s. The second source is a BMC Public Health article from the Action Malaysia Study 2025, which examines how nations and healthcare professionals view obesity and the challenges in managing it. By using these two sources, our explanation not only becomes trustworthy but also gives a clearer picture of how obesity affects different age groups and what factors contribute to this growing issue. Next, I will pass to Suraya.
Thank you, Shaira. Now, we look at the background of topic. Firstly, obesity can be defined as the excessive accumulation of body fat that could harm health. And also, obesity is also a major cause of serious diseases like stroke, cancer, and diabetes. Moving on, our central idea of our topic is that obesity in Malaysia is increasing among all age or groups of people. And it is important for us as a society to understand the causes, the effects, and also the barriers that make it hard to be avoided in our country. Now, I pass the presentation back to Shaira.
Correct. Thank you, Suraya. Now, I will explain graph 1, which is a scatter plot taken from the NCBI study. The purpose of showing this graph is to identify the causes of the increasing prevalence of childhood obesity in Malaysia. By analyzing the trend over time, we can understand why more children are becoming overweight and obese. The scatter plot shows the prevalence of childhood obesity by year of study from the mid-1990s to the early 2020s. The x-axis represents the year the study was conducted, and the y-axis shows the percentage of childhood obesity. Each circle in the graph represents one research study, and the size of the circle indicates how many children participate in that study. From the trend line, we can clearly see that childhood obesity has increased steadily over time. According to the NCBI article, 13.9% of Malaysian children are overweight and 11.8% are obese, showing a worrying rise. This increase is strongly linked to the several lifestyle factors. The study identified the main causes as poor eating habits, such as frequent consumption of fast food and sugary drinks, and lack of physical activity, especially with busy school schedules and limited outdoor play, and increased screen time such as smartphone and television. This lifestyle behavior explains why the graph continues to rise over the years. The graph made it clear that if these habits are not changed, more Malaysian children will be at risk of serious health problems like diabetes, high blood pressure, and heart disease at a young age. Therefore, the scatter plot highlights the urgent need for Malaysia to promote healthier eating, more physical activity, and stronger awareness among parents, schools, and communities. So, from this graph alone, we can see that childhood obesity in Malaysia is increasing and is strongly linked to the lifestyle factor. This sets the foundation for why change is needed, which will be explained further by my partner Suraya in the next section.
Thank you, Shahira. Ladies and gentlemen, The purpose of the second chart is to analyze the barriers to obesity management in Malaysia. This bar graph was taken from the BMC Public Health Action Malaysia Study 2025 for perception and barriers to obesity management. This graph illustrates the perception of both groups, people with obesity PWO and healthcare professional HCPs. As we can see, on the x-axis, it stated all the 4 major diseases, which are firstly stroke, secondly cancer, thirdly chronic obstructive pulmonary disease COPD, and lastly diabetes. Meanwhile, on the y-axis, it shows all the seriousness rating that have been given by the PWO and also HCPs. Next, we can see based on the bar chart that people with obesity had placed 72% concern on cancer and 74% concern for diabetes, as these are the most conditions that are commonly associated with obesity based on their own opinion. On the other hand, healthcare professionals had rated stroke and COPD as more serious because they rated 74% for stroke and 79% for COPD. This is most likely to happen because the healthcare professionals have a broader understanding of medical complication that is related to obesity. But however, from this graph alone, we can see that both groups actually understand and recognize the risk that comes with obesity. However, the rate of seriousness is depending on their own knowledge and their own experiences. Furthermore, the small gap between their overall perception that has been given in the graph can be said that is largely due to the limited public understanding of how obesity could contribute to chronic diseases. Because believe it or not, many Malaysians still have the mindset of obesity is only linked to appearance and also body weight. So us as a responsible society, we need to actually educate our society, and by having strengthened health education, bring greater public awareness, and most importantly to improve the communication between patient and healthcare workers, so that we can actually encourage earlier intervention and make greater prevention of obesity, because all in all, prevention is better than cure. In conclusion, what we can conclude that we believe that Malaysians must adopt healthier eating habits, and we all must try our best to stay physically active every day in our daily life to help reducing the obesity rate in our country. And at the same time, we believe that greater awareness and education are the keys for us to manage obesity more effectively in our daily life. That is all from us. Thank you.
Thank you.